Welcome back. Just yesterday, Rachel spoke with the biological dentist about what we need to know about our tap water. Here's that paid piece from the International Academy of Oral Medicine and Toxicology.
For decades, fluoride has been added to most of our tap water to help protect against cavities. But now studies are addressing how much is too much fluoride and whether it can cause problems, particularly in infants and expectant mothers. Joining us today to share some insight is biological dentist Dr. Griffin. Doctor, welcome to the show. I'll dive right in with our first question. What exactly is a biological dentist?
Thanks for having me, Rachel. Yeah, so a biological dentist functions like a functional medicine doctor in that we look at the whole person. Right, so I want to know why a person is getting cavities or infection. So we look for the underlying causes of their symptoms because oftentimes there's a systemic component. So we don't just look at the mouth only. And we're also very concerned with the materials we use, and we obviously will not work with any substances that we know are toxic to the human body, like mercury, nickel, and even fluoride.
Yeah, so I mean, this study is, determining how much is too much when it comes to fluoride. But what is the concern there? If we ingest too much, what happens?
Well, too much fluoride can negatively affect most of the organs in our body, including now brain function and activity. And this was confirmed recently by the National Toxicology Program. They're part of Health and Human Services, and they reviewed 52 worldwide studies and found brain impairment, including lower IQ, in babies who were born to pregnant moms who drank fluoridated water.
Wow, how were they able to measure this, specifically the fluoride levels for expectant mothers?
Yeah, so they would measure the urinary fluoride levels in the moms who drank fluoride, obviously, to pregnant moms who gave birth and did not drink fluoridated water during their pregnancy. And according to the majority of the studies and confirmed by the NTP, they found a steep drop in IQ as high as 7 points at levels that are lower than what's in most water supplies.
Wow, now, I mean, I'm sure there might be some people watching right now who might be worried. I mean, a lot of us have grown up drinking this water, so how much is too much? What do we need to know?
Well, according to Health and Human Services, again, we're all getting too much. And in fact, in 2015, they had to lower the amount that was allowed to be put in water supplies. It was the first time since 1945. And they did this mostly because they noticed that there were more kids who were getting these spots on their teeth, which is called fluorosis. It's the mottling, the more brittle white spots on their teeth. Every 2 out of 5 kids has that now. So that, combined with the fact that it's in all these other sources, right? It's in bottled drinks, it's in toothpaste, mouth rinses, dietary supplements, and even a lot of prescription medications. They had to lower it.
Yeah, and this all started to protect against cavities, right? So do you have any tips for how we can maintain these healthy smiles without the added fluoride in our water?
Yeah, it's going to sound simple, but it's tried and true. It's a combination of a good diet, right? One that's low in sugar, but you get plenty of vegetables, especially green leafy vegetables, good fats, ample protein. So just some good sound diet, and combine that with some good home care. And I mean, brush your teeth for a couple minutes, hopefully twice a day, floss daily, clean your tongue. And you can even gargle with a warm salt water rinse if you want to every once in a while. That gives a great antibacterial effect. So a good sound diet, good home care, that's really all you need. You do not need fluoride to have good, sound, healthy teeth.
The tried and true, just like you said. Doctor, thanks for being here. We can always head online for more info. We appreciate your insight.